All right, let's get right into it. For pretty much a generation, we've been watching this incredible story of progress unfold. But now, that story has hit a major turning point, a place where almost just isn't gonna cut it.
You know, for most of our lives, the big story in global child health has been a really good one. I mean, year after year, thanks to a ton of hard work and smart investment, fewer and fewer children were dying from things we know how to prevent. In this chart right here, this shows that success in the clearest way possible. Just look at that steady, downward trend. But remember, that's not just a line on a graph. Every single step down on that chart represents millions of kids who got to have a childhood, who got a real shot at life. This is the progress we've all fought so hard for.
So, what if I told you that for the first time since the year 2000, that line is about to go back up? Yeah. After all that work, after all those gains, we are literally facing a reversal.
This is the number we really have to wrap our heads around. After years of going down, about 4.6 million children died before they turned 5 in 2024. But next year, that number is expected to climb to 4.8 million. That's 200,000 more children. It's just a gut-wrenching statistic, and it tells us we are standing at a serious crossroads.
And that brings us to a really important choice. The future here, it isn't written yet. It all comes down to the path we decide to take, starting right now. And as we're about to see, there are two totally different futures waiting for us.
It's pretty straightforward, really. On one side, there's a path of funding cuts, of taking our foot off the gas. And on the other, there's a path of smart, strategic investment and doubling down on innovation. The difference between these two paths, well, it's not some abstract concept. It's measured in millions and millions of lives.
Now, this is where it gets really, really stark. A 20% cut in health aid, which some countries are actually talking about, could mean 12 million more kids dying by 2045. And a 30% cut? That number jumps to 16 million. That is the future if we choose path one. But the thing is, we don't have to.
So let's talk about the better path. Because this isn't just about preventing a disaster. It's about actively building a better world. And the good news is, there's a clear roadmap to get us back on track. A plan where smart spending and incredible innovation work hand in hand.
And here's that plan. It's a simple three-part strategy. First, we go all in on the stuff we already know works, like basic primary healthcare. Second, we focus on the new ideas that make every single dollar go further. And third, we keep investing in the next wave of game-changing tools that could wipe these threats out for good.
And listen, this isn't just some theory. Let me tell you about Governor Yayaha in Nigeria. He was facing a huge budget crisis, but he didn't just wait around. He found 500 ghost workers on the government payroll, saved over $1 million, and immediately reinvested that money to build 114 brand new health centers. That right there is spending with purpose.
And that level of commitment, it goes all the way to the front lines. Look at Josephine Barasa. When the funding for her program got cut, she didn't stop. She just kept showing up, unpaid, to take care of young moms and their babies in her community. Her story just shows you the need doesn't just vanish when the money does.
This brings us to a super important part of the roadmap, innovation. Because look, when budgets are tight, it's not always about spending more. It's about spending smarter. And there are some incredible new tools that are helping us do exactly that.
Okay, so this sounds kind of like a riddle, right? How on earth can giving one less vaccine shot end up saving $2 billion?
Well, the answer's pretty amazing. It's all about the PCV vaccine, which protects against pneumonia, one of the biggest killers of young children. The WHO has found that a new 2-dose schedule gives just as much protection as the old 3-dose one. That simple change could free up $2 billion that countries can then reinvest in their health systems. It's a total game changer, a perfect example of doing more with less.
And here's another brilliant innovation. For a while, mosquitoes were getting resistant to the bug spray on old bed nets. So what did scientists do? They developed new nets with 2 different kinds of insecticides working together. It's like a 1-2 punch. The result? They've already stopped over 13 million malaria cases in their tracks. A simple upgrade, a massive impact.
You know, Dr. Thacker's words just hit so hard. He says he remembers when his hospital wards were filled with kids suffering from diseases like polio. And today, because of vaccines, he barely ever sees those diseases anymore. And get this, it's not just about the lives saved. Vaccines are considered the single best buy in all of global health, returning an incredible $54 for every $1 you put in.
So, if we actually commit to this path of smart investment in innovation, what's the grand prize? Well, it's not just about getting back to where we were.
It's about finishing the job. It's about the possibility of wiping some of the world's deadliest diseases off the map for good.
Let's start with malaria. We have a whole new wave of tools coming. Everything from better vaccines to wild, cutting-edge gene drive tech being developed by African scientists that could literally stop mosquitoes from passing on the disease. With these tools, we could save an extra 5.7 million kids' lives by 2045. Okay, now think about respiratory infections, which are so dangerous for newborns. By rolling out new vaccines that we can give to mothers for things like RSV, we can protect babies before they're even born, and that could save another 3.4 million lives.
And this one for HIV prevention is just unbelievable. Imagine replacing the daily burden of taking a pill every single day with just 2 injections a year. Just think about that. This tech is real, and it could help us basically make HIV history.
So, all of this brings us right back to where we started, the choice. The data is all here, the amazing innovations are real, and the roadmap is laid out for us. The only thing left to do is to act.
So what does that look like? For policymakers, it's pretty clear. Aim the money at proven winners, like Gavi and the Global Fund, and protect those primary healthcare budgets. And for the rest of us, it means using our voices to remind our leaders that a child's right to survive and thrive, that isn't a political debate. It's a fundamental human issue.
We're really at a unique moment in time. The last generation showed the world that we could save millions of children's lives. Now it's our generation's turn to decide if we're going to protect that legacy and finish what they started. Every single life we protect is a whole future we help create. The only question left is, which future are we going to choose?